My name is Megan Lemon, and I'm a primary care nurse practitioner student at Auburn University. Today, I'm going to be discussing interstitial cystitis. I'm going to begin with a brief definition and overview. It is a condition of pain or discomfort in the bladder that is associated with the need to urinate frequently and urgently. It is often referred to as painful bladder disease, and there is chronic inflammation of the bladder wall. There is currently no known cause. However, researchers suspect that there is an abnormality in the bladder surface that allows potassium and urea to leak and absorb into the bladder interstitium. It occurs primarily in Caucasian females. There are two forms, mild and severe. The mild form occurs between the ages of 20 and 40 years. There's a normal bladder capacity. There are ulcerations and cracking of the mucosa with bladder distension. However, there are no symptoms of incontinence. In severe cases, this occurs between the ages of 20 and 70 years. There's progressive bladder fibrosis. There's a small bladder capacity and poor bladder wall compliance. Many of these patients have overflow incontinence or chronic bacteria in their urine that is not responsive to antibiotics. There are no known risk factors. However, there are a few associated conditions like fibromyalgia, chronic fatigue syndrome, depression, and migraines. 3 key questions for diagnosis include: how often do you urinate? There is a decreased bladder capacity, so many of these patients experience more than 8 voids in a 24-hour period. They can occur up to 60 times a day in extreme cases. The next question is to ask the patient, is it painful to urinate or when your bladder is full? This is also due to the decreased bladder capacity and their need to urinate more frequently. You'd also need to ask them if they have frequent urinary tract infections or vaginitis, or if these symptoms present during the week of their menses in female patients. A history of this is common, and interstitial cystitis is often a diagnosis of exclusion. So it's important to note this because these symptoms often can present similar to UTIs and vaginitis. In the physical examination, it's important to examine the perineum of both male and female patients. In female patients, they'll have perineal pain and anterior vaginal wall pain. And in men, they'll also have perineal pain, but they'll have prostatic pain as well. It's important to do a lower abdominal examination. You may note a distended bladder or painful palpation over the area of the bladder. It's also important to notice if there is any CVA tenderness, because these patients could often have a urinary tract infection that you could need to rule out before you diagnose interstitial cystitis. It's also important to do a urinalysis. Even though it isn't a physical examination component, it takes a closer look at the urine and allows us to rule out a subclinical urinary tract infection. There are some common treatments for this. However, it does not respond to antibiotics. The first line treatment is to educate your patient on interstitial cystitis, self-care, and stress management. They're going to need to implement lifestyle modifications in order to control this. They need to adjust their fluid intake, use heat or cold over the bladder or between the legs. They need to avoid diet triggers such as caffeine, chocolate, citrus, tomatoes, carbonated beverages, potassium-rich foods, spicy foods, alcohol, and acidic foods. They can use over-the-counter treatment such as Peridium. They can relax their pelvic floor muscles, but they need to modify or stop Kegels, sexual intercourse, or tight clothing. Constipation can also be a trigger for this. They need to manage stress and get help for anything that can cause a flare-up or make the pain worse, such as irritable bowel syndrome, recurrent vaginitis, depression, endometriosis, or panic attacks. The second line treatment is a drug. It's called Elmiron, and it tends to reduce the bladder inflammation. However, you need to let your patient know that it can take several months to be effective, and it improves the symptoms in 38% of patients. This is the only FDA-approved treatment for interstitial cystitis. They can also use pain medications, other oral medications such as amitriptyline, Integumet, and Vistaril. The last resort would be bladder installation medications such as heparin or lidocaine, or a cystoscopy to treat Hunner's lesions. You need to let your patient know that this is not curable, but it's controllable, and the lifestyle modifications will help you do this. The prognosis in mild cases is